Welcome, everyone. We'll get started very shortly. In the meantime, please share your name, organization, and where you're coming from in the chat.
And thanks, everyone. We just want to, as you're joining, remind you of a few items. So everyone will be automatically muted when you join the event, but we encourage your participation via the chat, as Kate has just mentioned, and also to use the Q&A function at the bottom of your screen to ask questions that panelists will respond to towards the end of the event. This live cast is being recorded, and we will make sure to share it with everyone who has joined. And we also have translation services available on the webinar. So if you go to show captions and click on the arrow above, you can select a different speaking language or translation to your preferred language.
And Will or Alex, it looks like the chat is not working for attendees. So if someone knows the magic touch to unlock it, then people will introduce themselves.
I'll look into it. I think, but for the most part, we would, oh yeah, so we're going to need to do that. Yep. Thank you.
Thanks, Alex.
I think I may have just enabled it, but anybody wants to give it a shot.
Thanks, Sandy.
Yeah.
Yusuf.
Great.
It looks like it's enabled now.
So now, please, everyone, go ahead and share your name and organization in the chat. And Kate, we'll give it one more minute until I think you can start us off.
Sure. So welcome to JSI's live cast, The Behavior Effect. My name is Kate Onyejekwe, and I'm the director of JSI's International Division in Washington, D.C. This is the second in a three-part series on person-centered care, an approach that centers individuals, carers, and communities as active participants in their own care. In our last event, we discussed how a policy and financing environment that enables person-centered care can be created. This really set us up for today's conversation by reminding us how critical accountability is to delivering person-centered care. Accountability is very complex. We know it's important, but we don't all think about it in the same way. So just to set us off on the same page, in the context of person-centered care, accountability means that actors are mutually responsible for achieving an agreed upon common goal. So what does that mean? It means that accountability is multidirectional. It means that everyone has some part to play in the ecosystem of care in relation to everyone else, not in isolation. And for that to be effective, we need a common understanding of three critical things. First, what does it mean to be accountable? And we've already sort of set that up as we're coming in. Second, what works to hold people accountable? And finally, what happens when an actor is not held accountable? With that, I'm really excited to get this conversation going with 4 colleagues from literally all over the world. I'll let each of them introduce themselves to you now. Christine, why don't you start us off?
Sure. Thank you, Kate. Hi, good morning. I'm Christine Galavati, and I'm with the Bill and Melinda Gates Foundation based in Seattle. And I help shape and manage investments to help people make and act on their reproductive decisions and choices. I was formerly with the Centers for Disease Control in Atlanta, and then with CARE, where I first really learned about participatory governance and accountability and ways to help programs be more responsive to people's needs and preferences. So I'm delighted to be here. Thanks.
Thank you, Christine. Subi?
Thank you, Kate, for setting the tone of the event. Hi, I'm Dr. Surbhi Seth, a public health enthusiast from JSI India. And today I bring you greetings from JSI PL India and on my personal behalf. My work over the last decade has extensively been to support the government and the development partners in shaping health policies and programs aimed at improving maternal and child health outcomes. Today I'm here and I'm quite excited to share my thoughts and views, which largely come from my work with the national government around some of the recent initiatives on quality of care around birth, positive birthing experience, and respectful maternal care, which quite a lot talks about person-centered care. Looking forward to an interesting panel discussion. Thank you.
Thank you. What a rich experience you bring, Subi. Excited. Kayode.
Yes, thank you very much, Kate. And it's really my great pleasure being here at this live cast. I'm Kayode Afolabi. I'm a reproductive health expert. And my passion is working on reproductive, maternal, newborn, and child health, with particular reference to women's health, and especially taking care of their sexual and reproductive health needs. And of course, not leaving behind the young girls and other adolescents. I really look forward to a very exciting moment. And once again, I thank the organizer for bringing me up here. Thank you.
Excellent. Anel?
Greetings to everybody. My name is Anele Yawa. I am the General Secretary of Treatment Action Campaign in South Africa. I am a public healthcare user, but also our primary focus as TAC in South Africa is around community-led monitoring to monitor services that are meant for people living with HIV and key populations. I'm happy to be with you, and I hope that I will make a positive contribution in today's discussion. Thank you.
Thank you so much, Anele. You can see that we have assembled a really interesting panel, and we thank you for joining us for this event, this afternoon, evening, whatever time of day it is for you. So in our last event, we discussed the importance of breaking down silos between programs. And that's really the essence of person-centered care, isn't it? So this question is really around how we can prioritize accountability to support holistic programs and prioritize people over diseases. So Christine, why don't we start with you? How have you seen accountability support people-centered programs in your work?
Thanks, Kate. Yeah, I think there's sort of two main ways that come to mind that a well-designed and implemented accountability mechanism can support holistic person-centered programs. First, I think we as donors, implementers, often spend a lot of time, energy, resources on kind of the hardware and the nuts and bolts of the health delivery system. But in doing so, we sometimes lose sight of the clients and the community. And that's really where health is produced or inhibited in the community. So accountability mechanisms like community scorecard, citizen voice and action, and those other kinds of approaches really help facilitate bringing together the community system and the health delivery system, and help facilitate a dialogue and build understanding and that mutual accountability you talked about at the beginning. Which brings me to my second point, which is that health systems, as we know, are human systems. They consist of people, both on the delivery and the community side. And people have with different needs, concerns, constraints, roles, responsibilities, power within those systems. And so connecting them and facilitating that dialogue and building that understanding through these kinds of accountability approaches not only helps rights holders voice their needs and preferences, but can really help duty bearers to be more responsive in meeting those needs. So overall, I think these accountability mechanisms can support two-way communication and build trust. And trust, I think, is really the fuel needed for holistic, person-centered care. Thanks.
Thank you, Christine, for that introductory sort of bifurcation, but connection between the hardware and the software of the health delivery system, the nuts and bolts, the system and the people. But the people are the critical elements. And so we need to connect the people as individuals and the communities and the health system in general. And you've really centered it for us for a start, that these accountability mechanisms enable us to bring them together and in a really critical way. Afolabi, what about you? What is your perspective as a government leader on this question?
Yes, thank you so very much. And I thank Christine for bringing her perspective, especially around the issue of trust. I also want to add to this, when we talk of accountability, we should always realize that it's a very strong tool to bring the shared vision to the front burner, shared vision among all the players, all the actors, all stakeholders. And with the shared vision, once accountability is built into a program, then the trust will also be built, and this will be strong and will be the foundation of a successful program. I want to just cite an instance from my experience working as a director reproductive health at the Federal Ministry of Health. There was a time we had challenges with family planning funding in the country. And looking at the old issue, what we did was to build accountability into funding family planning program. And this led us to having a budgetary provision for family planning by the federal government of Nigeria, which had never been before. And of course, when we saw the achievement of accountability, or what accountability is bringing into strengthening the program, we had to spread this to the subnational level. You know, in Nigeria, we have 36 states and FCT. So we established a state level accountability mechanism as well. And this encouraged states to also be responsive to family planning, funding family planning. And dramatically, 34 out of 36 states in the country also started to have budgetary provision for family planning. And we were able to create a basket fund for family planning procurement, which UNFPA manages for us. And another very interesting and tremendous outcome of this was that the basket fund was also being funded by donors. So not only the passion and interest of the national stakeholder,
We seem to have lost Kayode there, but he was already really talking about the story of a wonderful ricochet of what accountability can do, from having the shared vision, building in mechanisms that enable real commitment, trust from the donors, and buy-in from 34 out of 36 states in the country. and leading to a basket fund. So that's really just a very wonderful idea or picture of what setting in accountability mechanisms can do. With that, let's go to a question from Amongi Sharon, a youth counselor in Nigeria.
Hello, my name is Amoy Sharon, a youth counselor from Little Referral Hospital in northern Uganda. As a youth counselor, I help other young people with adherence counseling, psychosocial support, and their caregivers that leads to better life. My question to the panel today is, what steps can I, as both a care seeker and a youth counselor, take to hold healthcare providers, community leaders, and government officials accountable for delivering person-centered care?
Thank you so much, Sharon, for that question. Anele, you're an activist and you're in the middle of all of this. So let's start with you. What do you advise Amongi based on your experience as an activist?
Thank you, and thanks for the question. I think step number one is all about how do we make sure that we empower communities? How do we make sure that we empower people living with HIV, young people, in order for them to be able, firstly, to take personal responsibility about what has to do with their lives. And then after that, we need to empower our leaders, both at community level as well as at other levels, in order for them to understand the conditions our people are living in. And by doing so, it therefore means the decisions that they are going to take as duty bearers, those decisions needs to speak to the needs of the people. But also, when you talk about accountability, or we need to talk about responsibility and transparency. On a number of occasions, people, more especially those who are occupying high positions, they are privileged in terms of making laws and policies about the healthcare system, yet they don't access services in the same healthcare establishments that they are in control of. Let's come to Africa. Majority of the African leaders are in control and they take decisions about what needs to happen in terms of strengthening the health system. The same African leaders, when they are sick and dying, they take their first flight to Europe. It therefore means they build the health system for the poor and they are unable to access the same services. So what does accountability mean? It therefore means, firstly, we need to engage with duty bearers and decision makers to say, when you make policies, don't make policies for the rest and not for yourselves. You need to be part and parcel of everything that you seek to do for the people so that you can be able to improve the quality of services. Lastly, it is important that when we talk about accountability, we are able to hold ourselves accountable first, so that if I am a
We seem to have lost Anel there. Okay. Just really some passionate exposition of accountability at all levels, starting from me, the person, and just taking personal accountability for my responsibility for my decision making. But he also brings an important point about leadership, that leaders across every area should actually be involved in the systems that they are trying to deliver for people. You're not making decisions for others that doesn't include you. And so an investedness of the leaders, even in the decision making and in the systems and policies that they call upon for people. So it comes back to the point that it's everyone, everywhere, starting from me, the person, the community, the leaders, the bringing in transparency into it, and also responsibility. This is all really aligning together for us right here, even as we experience some unfortunate issues with our technology. That's what happens when you're calling from all over the world. Subi, you've worked in government as an implementer as well. So how has JSIPL supported care seekers and youth to hold people accountable for person-centered care?
Yeah, Kate. So yes, there have been multiple initiatives that have been taken by JSI in supporting people with the person-centered care, and one of the biggest examples is the learner-centered care that the JSI India implemented, which is the a RISE platform, which is a learner's platform where the health worker can get themselves trained and assess themselves and relearn using a very handy platform of learning on immunization. And some of the projects that have worked beautifully on ground have also come in the arena of adolescent health and nutrition, where the community engagement has been the central tenet towards ensuring person-centeredness. But carrying from what Anel said and the question from Nigeria, I would actually like to give some simple steps that even the national government has been implementing in ensuring accountability. For example, having a citizens charter at the health facility where the user or the person who is seeking care is well aware what are my rights and my responsibilities, and also as the health provider, as the duty bearers, as Anil said, they know what are their rights and their responsibilities. But then for that to happen, the citizen or the care seeker needs to have a guided empowerment that these are my rights and this is where I can seek them. Another thing can be having a very meaningful dialogue with the care seeker, with the counselor or with the service provider before providing an informed consent. And a third can be using wherever possible the mechanism of providing user experience scores, using a grievance redressal mechanism wherever possible, wherever institutionalized. These are some of the small mechanisms, but they act huge when it comes to numbers, when it comes to evidence generation, that whether the care seeker is satisfied, whether the facility was up to its utmost level of providing the person-centered care. Even as a care provider, just enabling and demonstrating good practices of good user experience, providing or institutionalizing a mechanism to capture user experience is some of these steps that can be easily used and be beneficial in a long term. Yes, so those are my remarks on that.
Thank you, Subi, for highlighting the importance of things like citizens charter, guided empowerment, mechanisms, and the user experience cause. Hopefully they have helped to respond to your question. Our next question comes from George Mangi Fedele in South Sudan.
Hello, my name is George Manga Fedele. I serve as the Resilience Advisor in South Sudan for the Momentum Integrated Health Resilience Project. As the panelists know, South Sudan is considered a fragile setting, and as per 2018 Fragile Index score, South Sudan was the most vulnerable with the score of 113.4, followed by Somalia and Yemen. My quick question to you is how and what should be considered when tailoring a person-centered care accountability intervention when working within fragile health system? Thank you. Over to you.
Thank you, George. Christine, this seems like a great question for you. What accountability considerations should we make when delivering person-centered care in fragile settings?
Yes. Well, although it might sound counterintuitive, I think one of the most important things is paying attention to the health workers, those workers on the front line, because it's critically important for ensuring tailored person-centered care, particularly in these kinds of situations. Health workers are working in incredibly difficult circumstances. They have inadequate stock, huge client loads, the pressures and constraints that are coming both from within their work environment in a fragile context, as well as outside in the community. So I think it's really important to recognize this and to make sure that they feel heard and supported as part of an accountability process. In every project I've ever been a part of, the health workers are often very skeptical, if not antagonistic to the idea of accountability, because they already feel overwhelmed, criticized, underappreciated. And they feel like, they don't have time, they don't want more oversight, criticism. But that's why I think accountability processes that are really focused on that intersection between the community and the frontline providers need to be about collaboration and building that mutual trust, because these kinds of processes have been shown, as we all know, to improve relationships, build alliances, improve quality and outcomes, even in humanitarian settings and in some of the most fragile contexts. So, thank you.
Thank you. Focus on the health worker in a non-antagonistic way, in a way that bridges the gap between the community, the person who's receiving care, and the health worker. Collaboration and mutual trust. Thank you so much for bringing in those concepts for us. Again, Christine. So thank you, Christine and Afolabi. I'd like to shift a little bit to thinking about what works when we hold people accountable. Could you share sort of some of the examples of where using social accountability mechanisms have resulted in substantive policy or practice changes, and what information we need to be effective in making that happen? And I'll direct the next question to Anele. Hopefully we'll have some disruption to your very passionate exchanges with us this afternoon.
Thank you, Kate, and apologies about that. I suspect that it was load shedding. We have a problem in South Africa, which I think we must address at some point, of not having enough electricity. But I think let me share a little experience of what we are doing in South Africa. In South Africa, we have started a global program which is called community-led monitoring, whereas people living with HIV and other public health care users, firstly, we had to enter into a memorandum of understanding with the National Department of Health. And after that, we said we are going to monitor the quality of HIV, TB services, as well as services that are meant for key populations in more than 400 facilities in South Africa. And us monitoring the quality of these services, we are engaging with the public health care users, both people living with HIV, key populations, and people living with TB. We are engaging with healthcare providers in the form of the pharmacies, the nurses, and facility managers to try and understand what are the challenges around issues of quality of services, issues around the working conditions of the healthcare workers, issues around the availability of medicines, because on a number of occasions, people are experiencing shortage of medicines when they go to facilities. And lastly, the long waiting hours where people have to wake up as early as 5 a.m., queue in those clinics that are going to be opened at 8 o'clock. And above all, issues around stigma and discrimination. Through that way, we are able to produce reports, and these reports are tabled to duty bearers. And through that, we engage with duty bearers at all levels, up until to the level of the Minister of Health, where we are able to raise some of the pertinent issues that affect the public healthcare users in order for our government to be able to respond to those issues, because our government does not have eyes and ears everywhere. And as the result of that, we as the people living with HIV and key populations, through the community-led monitoring, we were able to have a seat around the discussion table where we continue to raise the voices of the voiceless people from our communities, and where we are listened to. As much as issues are not resolved immediately, but what is important is that all the frustrations of the public healthcare users of our communities are tabled at these levels. And as the result of that, because of our resilient work, the Minister of Health has appointed me to be part of the board of directors of the Office of the Health Standards Compliance, where we monitor norms and health standards, where we're making sure that we inspect the quality of health establishments and enforce laws that are enshrined in the Constitution in order for all our health establishments and healthcare workers to be compliant as means to ensure that we provide quality services to the people of our country. Thank you.
Wow, that's really impressive, and congratulations on your appointment, Anele. And Subi, where have you seen social accountability result in change in your experience?
Okay, so there are a lot of some of the significant examples where the national programs have articulated the role of civil society and community at multiple levels of accountability and decision-making, in fact, including the financial expenditures also, be it at the village level or be it at the district level or at the state or the central level. And a very recent example has been where the social accountability or the community-based scores have now become a part of the performance, a strong measurement for the performance of the health and wellness centers at the primary healthcare setting. But having said that, a very specific example, and coming back to how community scores or how community experiences care, I would like to draw your attention towards the quality certifications of labor rooms in India. This is where my work comes from, where these scores given by the users as an experience have actually helped to transform the quality improvements, both structural and processes. They are a mandatory part of the quality assessments, certification, sustainability and validity of those certifications for the labor rooms, and also for providing incentives for good work. So, for example, to receive an incentive for a quality certified labor room in a public health setting in India, one needs to have a minimum of 80% user experience being satisfied or highly satisfied. So something like that has been able to transform the quality of care that has been provided, and it is pretty much the part of the policy. So I believe that simple user experiences, simple scorings gathered from the community can validate quality assurance and can be a contributor to the person-centeredness.
Thank you. So they not only make sure that people whose voice have not been heard, as in Anele's case, are now at the table speaking to the policies that affect them, but also they do help to increase quality of care and incentivize quality action as well. So thank you all for that. Now, these are all positive, really positive actions that come out of accountability mechanisms. And I'd like us to go to something that I grapple with as well, and many of us do grapple with, which is how do we ensure that actors are answerable to right holders and ultimately held responsible if they don't follow through on their commitments? So we've seen good examples of social accountability mechanisms working, but what if they don't follow through? What if it doesn't work? How do we make sure that happens? What do we do? Christine, can we start with you?
Sure. That's a hard one, as you said, a challenge. But I think one answer is simply it depends. I think Survey's example is a brilliant example of a mechanism that really does have some teeth in it to, hold people accountable with that certification process. But if I had to pick one kind of enforcement strategy, you won't be surprised that I would say by shifting as much power as possible to the front lines, to the community and the frontline providers. If they're empowered, and again, as Survey said, a facilitated process to really make that a reality. If they're empowered and there are mechanisms in place, like that scoring system, that support this connection, communication, and working together, then I think they can engage in what you might call, collective bargaining with higher levels of the system. And I would argue that when they do come together and voice their collective demands on the system, whether it's for more resources, more training, more respectful person-centered care, those demands are more likely to be met. I've seen this over and over again. When 600 community members, along with their local health providers, show up for a meeting with district or provincial health authorities and policymakers, clearly articulate their specific concerns and needs, and I think that's an important part of it, and express their intentions or have a mechanism for tracking progress on meeting those specific demands, like that certification. That's a lot of pressure on the system, and actions are taken. So thank you.
Thank you. This is such an important question, so I'd like each of you to please weigh in. Subi.
I think I will just carry on where Christine left, that there has to be a measurement matrix to measure person-centered care. Without that, how do we generate an evidence? And without that, how do we advocate that the things are not in place? So one, having a measurement tool, a very comprehensive measurement tool that not just talks about the structures, the processes, but also comprehensively chips in the community's voices together. Something that beautifully works is the articulation in the policy documents that these are the stakeholders responsible for these kind of work. Incorporating those into the performance indicators of a health facility. And then nothing is more powerful than having a robust grievance redressal mechanism, a robust mechanism to capture the perspectives and the experiences from the community. I think these are some of the things that can help produce data, and then the data can be used further for advocacy, for gap fulfillment, for making financial planning, and gaining a lot of convergence over the attention over this thematic area. Yeah.
Thank you, Subi. Afolabi.
Yes, thank you so very much. I also look at a very strong area that has to do with coordination and leadership. This could actually become very important. I'm happy that Subi mentioned the use of data for decision making, because if someone else around issue of accountability. You need to actually have data for performance management, and also your coordination must be strong enough to enable every player to know the rules of the game. Let them know the 4 principles of person-centered care. Let them know that the clients have their rights, and a provider who has taken a decision must be able to justify such a decision if it becomes an issue that is challenged. And when it comes to leadership, government also really need to put a system in place for strong performance management, as well as how an erring provider or even policymaker or program manager will be held accountable for what they are to be responsible for. For instance, if everyone knows that there is sanction for a particular issue, irrespective of the level of such an actor, whether in government or in the civil society, they want to keep within the rule. They want to, keep to their commitment. And that is what accountability can actually do, especially if I have some teeth to bite and the necessary awareness is created for everyone concerned. Both the clients on one hand, and then the service provider, as well as program manager and even government on the other hand. Then finally, let me say that advocacy can really help so much to make those accountable to actually deliver on their commitment. So advocacy at a different level will also be used as a tool to enhance accountability. Thank you.
Thank you, Kayode. Anele?
Let me follow from where Kayode left. I think also when we talk about advocacy, we need to improve and make sure that we've got data so that we can be able to put on the table evidence-based advocacy. But also on a number of occasions, when civil society is applying advocacy, civil society is often accused to be anti-state, yet civil society is not anti-state, but they are trying by all means to be the mouthpiece of the majority of the people. But also, we need to understand that globally, nothing about us without us. So if these things are not working, how do we make sure that as communities, we take full control and ownership of the services that are meant for us? And we engage with those in power and say, look, in this particular area, there are 1, 2, 3 problems. And we have tried to reach out to you based on this agreement, but you are not coming to the party. So what do we do? It therefore means if we engage, and we do not see any improvement, what does that mean? It therefore means the question you must ask, where does the power lies? The power lies with the people. It therefore means we must go on the streets, on the grounds, organize and mobilize. How do we make sure that we use the courts of law, the constitution, the law to defend our rights? Because this is all about human rights and social justice. And therefore, if the rights of the public healthcare users and the people in general are violated, what must we do? We need to use the constitution and the law as the only weapon that we have to defend and protect our rights. But also, at times as civil society, we are forced to take actions that we do not intend to take, because those who are in power, they are too comfortable in those offices with Econ, and they do not understand the issues which affect the people on the ground. This is all about the people, those who are the users of the services, not those who make policies. Because as I have said, on a number of occasions, those who make policies and take decisions on our behalf, they don't go back and access those services. When they are sick and dying, they take the first flight to Europe. So it becomes our responsibility to put pressure to those in power. And if it means we must occupy their offices, we must apply civil disobedience. Let it be until the rights of the people are respected by all. Thank you.
Thank you so much, Anele. I just feel like, we're all, really aligned from Christine's. We come from Christine's, the power of collective bargaining, to, Anele summing it up in nothing about us without us. But before that, we need to have agreed upon measurement indicators. We need to have data that enables us to make what? Evidence-based advocacy. And we need to use agreed upon mechanisms, including the law, including the Constitution, to address whatever the lack is in our collective understanding of what person-centered care indicators are. So thank you all for taking us through this. This is really exciting and interesting. I think we want to take a little bit of time to take some questions. Do we have a couple questions to take before we get on to the end game here?
Oh, yes. We have lots of questions that have come in, which is fabulous. So a couple have been about measurement. Naming that, measuring social accountability is complex and challenging. This person has used scorecards and used measures that track quality improvement over time, and would love to hear your thoughts on measurement, and if you could point to any tools or guidance on thinking through measures for accountability. And similarly, another person also wanted to know of any standard and validated measures of user experience.
So this sounds like a question that goes to you, Subi. You've talked a bit about user experience and measurements. Everyone agrees with that. So could you provide some responses to these colleagues?
Okay, yeah, so there cannot be a standard format or a checklist on user experience. It needs to be contextualized on the setting that you're coming from. It will be very different for a health facility in a private setup versus the public, although the community is same. And it will be very different from the primary health setting in a tribal versus a primary health setting, again, in a town area or in an urban area. But some of the elements, suppose we can have for a country context, one can have a few indicators which can be tracked, which are common, but there always should be a flexibility to add in a few indicators which are very, very specific to that kind of context. I can give you a very simple example. A facility in a desert area may be facing water shortage in the health facility, which might not be an issue in an urban setting, but having a 24/7 water supply given, a water facility provision given to the care seeker as well as the companion can be one of the quality indicators which is common. So one may score, do we have everything in place? As two, do we have something partial, or do we not have something like that? So this kind of flexibility must be there in the measurement tool. I hope I'm able to answer that, Kate. If anything is left, please let me know.
Thank you. And we always have the option to continue this conversation, really. So thank you so much for that. Do we have one more question before we continue?
Yes, so I think there's one question about the role of civil society in ensuring accountability, and I know Anele has been speaking very well to that point. So maybe he can continue, and Afolabi can chime in from a government perspective.
Okay. Anele.
As I come in, yes.
Yes,
So I think the role of civil society cannot be defined by government. The role of civil society must be defined by the communities themselves, because the power lies with the people. Two, civil society needs to know that we are not an extension of government, but we represent the wish, the will, and the rights of the people. And therefore, at all times, we must be on the side of the people. We must be able to go to the people, get the mandate from the people, engage with those in power, and go back to the people to give them feedback. That is the first part. And then the second part, we need, when we engage with government, we need to understand that we do not represent our jackets. And therefore, it can be true that the civil society will think that we must always be the praise singers of the government, even when it violates the rights of the people. Let me give you a typical example. The whole world is talking about sustainable development goals. You name them all, key populations and all these rights. Look what is happening in Uganda, where the LGBTQI rights are violated, where people, if they identify like this, they are going to be murdered by their own government. Where are the people of the world? Where is the International Criminal Court of Justice? Why we do not bring the government of Yoweri Museveni to the ICC for the violation of human rights? At times, civil society that is captured by the government, they are unable to speak truth to power and challenge the establishment. Our duty is not to be anti-government, but our duty is to defend the rights of the citizens. And therefore, if we do not speak truth to power and continue to defend the citizens, all of us are going to die because of leaders who only think for themselves and for political interests. Therefore, as civil society, we need to be united as a fist so that when one of us is rights are violated, we are able to stand up in solidarity and say what they like. For instance, at times I begin to ask myself, why do we have United Nations, UN, WHO, when the rights of the public healthcare users on the ground will be violated? When are we organizing and mobilizing to challenge these establishments? Because at times it is like a rhetoric when those who are privileged speaks on behalf of the people, as Bob Marley says, who feels it knows it well. We need to organize and mobilize. As civil society, we need not to mourn, but to stand up and fight against any form of injustice and human rights that is imposed against anyone. Thank you.
Thank you, Anele. What you've passionately articulated is really a challenge to us all in terms of the role of civil society. And Afolabi, as someone who's worked in government, do you have any perspectives to add to this?
Yes, thank you very much, Kate, and I appreciate the passion that Anele brought, onto the table on this discourse. When we're talking of measurement and accountability as far as government is concerned, it's not as difficult as it may appear with the civil society or the community-based organization, because in government is all about performance. For instance, let me just give a few instances. The first one is about financial commitment that government made. All African head of government committed to Abuja Declaration in the year 2002 or so, that 15% of the total annual budget will be allocated to health. It's only very few nations that have met with this. Even my own country, the giant of Africa, has not gotten close to 15%. I mean, so that is quite easy to measure. Once there are data, we can always track the performance. And that will give us reliable measurement on accountability. Also, when we talk of funding accountability, we should go further down to the release of funds. If they are appropriated, were the sum released? And then if the sum were released, were they actually utilized for what they were meant for? So the measurement, we have to go down the line and then with a feedback up on the performance of such funding release. And let's also look at other commitments that government has made. Nigeria was a signatory to the Millennium Development Goal. We didn't make it. Most other African countries were. I think Ethiopia and one other country only made it. We are on SDG now. Are we on track? So it's easy to measure accountability with government because it is usually about performance on what government has made commitment to. But then I must agree that there is always that reluctance to really measure or track performance of government when it comes to accountability. But it is quite measurable. The indicators are always there. Thank you very much.
Thank you, Kayode. And as someone who holds purse strings, Christina, what's your perspective on this?
Yeah, well, it's a challenge because if you want, I mean, I completely agree with Anelli, and I would be right behind him marching into an office if that were the strategy that needed to be taken. But I do think this focus on more collaborative approaches between community and government can be very powerful. And especially when we're talking about the front lines. So these are health workers who are trapped in the same dysfunctional system. I'm not talking about the higher levels of the system. And so the social accountability can really center community and frontline workers who are the most affected by the failures in the health system. It's not the person, as Anelli said, who gets on the plane and goes to Europe when he has a big problem. So, you know, these are the people who should be centered, and yeah, and there are a variety of approaches for doing that. But, you know, they're the ones that know what the problems are. And when we can expand the space for them to articulate those problems, negotiate effectively with other stakeholders in government, you know, I think that's a way that really can lead to positive change. So
thank you so much. This has been really a fascinating discussion. I'm sure we could continue for quite a while, and I appreciate all the comments that have come in. And thank you so much to this distinguished panel for all your thoughts and all the experience that you bring to the table. We have just reconfirmed how critical accountability is to person-centered care, because without accountability, it is not possible to really articulate and connect all the elements of the care system in one, you know. So it's really important that we have some clear measures for articulating that, what we owe one another as duty bearers, what we owe one another as people seeking care. And as Christine always talks about, the healthcare provider should not be seen in an antagonistic relationship in this. And our leaders should also be held accountable. And so we should find mechanisms, not just for building trust, but also for really making sure that we hold one another accountable. And we found a few mechanisms for that. Subi talked about the user experience, the citizens charters. Kayode talks about the performance management systems in government. And Anale passionately calls us our attention to how we hold leaders accountable through the law. And laws sometimes involve elections as well. And so we have our duty, not just as recipients of care, individuals, but also as citizens of our communities, to participate at every level in assuring that the systems, the people, the communities, and the structures that enable person-centered care work for all of us. So thank you so much for this wonderful experience and our wonderful panelists. And we have recorded this session. We will have a summary with key takeaways available on our website. And we hope that you'll join us for our final live cast in the series where we'll discuss, yes, service design, service experience, and access, the nuts and bolts as Christine had talked to us about as it relates to PCC. Thank you and have a good rest of your day.
Thank you, Kate.
Thank you, Kate. Thank you, team.
Thank you.